We'll begin with Natalia. Natalia?
My name is Natalia, and I'm going to talk to you about my ovarian cancer. And normally I'm an immigration lawyer, and I work with child victims of torture, slavery, and human trafficking. And so I'm coming into your office, I'm your patient, and I'm going to tell you that in 2004, I was on the US-Mexico border, and I was knocked unconscious in a car accident. My injuries weren't serious, but I had neck and pelvic pain that followed me continuously for years. And I had heard a lot of stories of other people's severe pain, so mine didn't seem that serious, and I learned how to ignore it, which is a huge mistake. So that's lesson number one. Awareness of pain and self-reporting varies hugely across cultures and people, and I completely underreported my pain. Then in August 2007, because of continued pelvic pain, my doctor ordered an MRI where 2 masses showed up in my ovaries. Nothing to worry about, she said. I was moving to a new job in a new city, and she said, we'll just follow it. I started getting lots of neck, abdominal, and pelvic pain that I thought was from the car accident. Then I started having irregular, heavy periods. I thought maybe menopause. And because I was in a new city, I couldn't get into a primary care doctor or gynecologist. So here's the number 2 lesson. If you change medical systems, it can be really deadly. The pain got really bad, and so in November 2007, I went to an emergency room where they prescribed narcotic painkillers, muscle relaxants, and sleep medications. Here's lesson 3. Drugs can cause all kinds of symptoms that get mixed up with symptoms of an illness. And it began to be hard to know what was me, what was my pain, or what were the effects of the drugs. The pain got worse and worse, and the irregular heavy bleeding continued, and the masses in the ovaries were unchanged. I went from 130 to 95 pounds. I couldn't sleep, I was trembling constantly, I was off balance, I had trouble walking, sometimes trouble talking, believe it or not. I thought I was dying, but I didn't know why. I had multiple emergency room visits, gynecologists, internists, neurologists, pain management specialists, and lots of tests. But the word cancer was never mentioned, and few of the doctors did a physical exam. A lot of the younger doctors looked at their computers while they were talking to me and didn't look at me very much. And they diagnosed me with things like fibromyalgia, maybe gallstones, and unbeknownst to me at first, anxiety disorder. So another lesson is to consider the value of physical exams, and I'll talk about this a little more later. After 3 months, I was sicker and sicker and sicker. I'd lost my new job, I lost my apartment, and I had no end in sight to my illness. In January 2008, I had trouble breathing, so I called an ambulance and arrived at yet another emergency room. And after more tests, again, nothing obvious explained the pain, so they said, consider a psychiatric evaluation. I was in absolute agony and thought I was going crazy, so I admitted myself into a famous medical psychiatric unit, and at that point I transformed into a psychiatric patient, something that completely changed how the whole medical system related to me. And if you remember one thing today about my talk is this about psychiatric issues, just a label. Just like with cancer, just a label when you're looking at a patient. It doesn't mean they don't have medical symptoms. But from then on, my doctors treated me differently and often made decisions about my care without the same kind of consultations that I had had as a non-psychiatric patient. Psychiatrists in locked psychiatric units have almost total power over patients, and even my internist couldn't overrule what they wanted to do to me. And until April 2008, I was in and out of emergency rooms and admitted to 3 more psychiatric units every time that nothing else seemed to explain my symptoms. Psychiatrists told me that my pain was somatization, it was all in my head. They took away pain medications, they denied that there were side effects of some of the drugs, they pushed treatments on me that I really didn't want, including electric shock therapy. And I felt like I was in a battle of wills for survival. I had no history of psychiatric problems prior to this. But because the doctors said so, even some of my family members stopped believing that I was really sick. It took all the force of my will and several very close friends to insist that something was wrong with me. We just didn't know what. I was on 10 different medications at various points. I looked like a skeleton. I was trembling constantly, had continued irregular bleeding, painful and frequent urination, and constant pain. So in April 2008, fourth psychiatric admission, an excellent psychiatrist not only believed my story, but was able to control my pain enough so that I could think and walk and talk. And he called an internist in who did a physical exam. At that point, my abdomen had begun swelling, and even though I was hardly eating. They referred me, luckily, to a gynecologic oncologist. At that point, I was so sick, I had no idea what was going on, but in no more than 30 minutes, he diagnosed me with ovarian cancer. My cancer antigen, the CA-125 at that point, was 1333. He scheduled immediate surgery, a full hysterectomy, oophorectomy, and found cancer everywhere, including in my diaphragm, and he staged it at 3C. At that point, I was 48 years old. Right after surgery, my CA-125 dropped to 133, and I began 6 months of a difficult course of chemo called Taxol and carboplatinum. My psychiatrist weaned me off the psychiatric medications, and 2 months after surgery, he said there was no signs of mental illness. It had been the cancer and the drugs likely causing these things. By January 2009, the CA-125 was below normal at 18, and the CT scan showed no tumors. I had a medical oncologist giving me chemo at that point, and he said I was cancer-free. He never mentioned recurrence. He said to check in with him in 6 months and go off and live my life. So I did, and I wish that were the end of my story, but it's not. Another important thing, recurrence. 3 months later, I visited my internist, who's known me for 10 years and who always does a physical exam. Even though I insisted, oh, I'm fine, he discovered abdominal pain and bloating on the physical exam that I hadn't even been conscious of. He ordered a CA-125, which by that time, 3 months later, was up to 270. The CT scan was still normal. I went back to my medical oncologist in April. By that time, my CA-125 was 470, but he still advised me to wait and see what happens. My gynecologic oncologist, the surgeon, on the other hand, told me he thought it was aggressive platinum-resistant ovarian cancer and urged me to get a second opinion. So, life-saving lesson, gynecologic oncologists know ovarian cancer. Medical oncologists may not. Even after a year as a cancer patient, I wasn't prepared for the kind of quick decision-making I would have to make at that point. By May 2009, I had second opinions by 2 gynecologic oncologists who told me basically, prepare to die. This cancer is incurable and terminal. And by June 2009, the CT scan showed tumors all over my abdomen, on the edge of my liver and my gallbladder. So this is less than a year ago. My CA-125 was almost 800, and they drained off 4 liters of fluids that were full of cancer. It was full of cancer cells, which was actually very painful, by the way. So now, because I hadn't been prepared for recurrence, I was in a crisis mode. I had to move, and in June 2009, I began a clinical trial chemotherapy called Taxotere and trabectedine every 3 weeks. It had immediate effects on reducing my cancer, but very grueling side effects, which make me, I'm still on it, which make me unable to do my regular job and sometimes even take care of myself. So for 6 months now, my CA-125 has been below 4, and my CT scans have been showing no visible tumors. So it's working against the cancer, but now I'm at another crossroads. The chemo is worse than the cancer at this point, but I'm afraid to go off of it because it's a clinical trial. I won't be eligible to receive this drug if I go off of it. So I don't want to have happen, what happened to me, I don't want to have happen to anybody else. So I hope my story will help you think in the future to please remember to look at your patients, believe your patients, listen to your patients, and even if they have psychiatric issues, same thing. Look at them, listen to them, believe them. Please consider physical exams and the importance of gynecologic oncology expertise. Thank you very much for your time.
I just want to say, as an ovarian cancer survivor, we really appreciate you doing the clinical trial. That's a scary thing to do, but that advances medical research exponentially, and we are deeply grateful to you.
And I'll be glad to answer questions about that.
We'll be taking questions at the end.